Hi, my name is Tuan He and I am a pharmacist. This video aims to help you understand more about a medication called Warfarin. At the end of this video, you will learn about the uses of Warfarin, the importance of taking Warfarin daily, blood tests to monitor for the effect of Warfarin, how diet, medications, herbs and supplements affect the action of Warfarin, the side effects of Warfarin, precautions, signs and symptoms to monitor while taking Warfarin. Warfarin is an anticoagulation medication, more commonly known as a blood thinner. It works by preventing new blood clots from forming or by preventing an existing blood clot from becoming bigger. Warfarin can benefit patients with a blood clot in their legs, such as in deep vein thrombosis, in their lungs, as in the case of pulmonary embolism, in certain forms of strokes, irregular heart rhythm, heart valve replacements, and other conditions that predispose a person to increased risk of blood clotting, such as in thrombophilia or antiphospholipid syndrome. The duration of treatment can range from a few short months to long term. Good morning, Ms. Siti.
Good morning.
Please take a seat.
Thank you.
The medication you are taking is called Warfarin. Are you able to recognize the tablets and the dose that you are taking?
Yes, I can. I am taking 3 mg every day, 1 blue tablet every day.
Very good. Please try to remember the strength of the tablet by its color. Warfarin is available in 3 different strengths. The brown tablet is 1 mg, blue tablet is 3 mg, and pink tablet is 5 mg. The brand of Warfarin is called Maravan. It is important not to change the brand of your Warfarin, as different brands of Warfarin can give different blood thinning effects, which can affect your blood test results. Please store Warfarin away from direct heat and sunlight. As much as possible, keep the tablets in the amber bottle or in the original white bottles that the pharmacy provides. If you prepare your medications in a pill box, ensure that the tablets are not discarded before taking them.
I know Warfarin is a blood thinner, but will it be able to remove blood clots in me?
Warfarin prevents an existing clot from becoming bigger while waiting for the existing clot to resolve. However, it cannot remove clots. Its action to thin the blood also helps prevent formation of new blood clots. It is also very important not to miss any doses. Try to take the medication at the same time each day so that it becomes a habit. Place the medication at a place that can be easily seen, for example on the dining or dressing table. You can even set phone alarms to remind yourself to take your medication.
What do if I miss a dose?
If the missed dose is within 8 hours of the usual dosing time, take it as soon as you remember. However, once the 8 hours has passed, skip the missed dose. Do not double dose, as it will increase the risk of bleeding. For example, if you take Warfarin at 6 p.m. usually, but on one evening you were busy and only remembered at midnight. Because it is within the 8-hour window, you can still make up the missed dose. However, if you only remember the next day at 7 a.m., then do not make up for this missed dose. Only take the next dose at the usual time, for example, at 6 p.m. Note down the doses and the date that you have missed and inform your pharmacist or doctor, as it may be important in the adjustment of your dose.
How do I know what is the right dosage for me?
As Warfarin dosing varies between individuals, close monitoring is required using a blood test, the International Normalized Ratio or INR, to help determine if the dose is appropriate. This blood test measures how long it takes for your blood to clot. Depending on your medical condition, your doctor will determine the target INR range you need to achieve. Before you start on Warfarin, your INR value is close to 1. As you take Warfarin, your INR value increases as your blood becomes thinner. A value that is lower than the target range indicates that the blood is too thick, which means that it is easier for blood clots to form. Conversely, a value higher than the target range means that the blood is too thin and the risk of bleeding is higher. Note that the dose of Warfarin you may need will change over time according to your INR trends. Frequent appointments for blood test monitoring are usually required, especially when Warfarin is just started, to ensure your blood is not too thin or too thick. It is also important to note that certain health supplements, traditional or herbal medicines, jamu, herbal soups and drinks, or even some Western medications like painkillers and antibiotics can affect the effects of Warfarin. Avoid taking any traditional Chinese medicines, herbs or jamu. Always check with your pharmacist or doctor before taking any other medications or supplements.
While I'm taking Warfarin, what kind of food should I avoid?
While on Warfarin, try to keep your diet consistent as much as possible. Taking too much or reducing your intake of foods, especially those that are rich in vitamin K, can affect the action of Warfarin.
What kind of food are rich in vitamin K?
Vitamin K is commonly found in foods such as green leafy vegetable, green tea, soya bean milks, milk feeds, as well as fruits such as avocados.
But I love to eat vegetables and drink soybean milk. Does this mean I cannot eat vegetables and drink soybean milk anymore?
If you are already taking these, you may keep to your existing diet. There is no need to entirely avoid foods that are rich in vitamin K or to eat the same foods every day. Most importantly, try to keep to the same portions. Avoid sudden and drastic changes to your diet, such as going to a vegetarian diet for 1 week and then reverting to your usual diet the next. For patients who drink alcohol, taking 1 to 2 cans of beer or 1 glass of wine occasionally is fine. However, large intakes of alcohol or hard liquor can affect the action of warfarin significantly and hence should be avoided.
I do smoke as well. Will smoking affect warfarin as well?
Yes, smoking can affect warfarin's action. Do inform us if you smoke or if there are changes to your smoking habits.
Does warfarin have any side effect? What must I look out for?
Warfarin side effects are commonly related to its blood thinning effect. Always check for signs of bleeding which can occur anywhere in your body. It can be obvious, like gum bleeding from toothbrushing or unexplained nosebleeds, or it can occur internally. If so, it can present as passing of blood in the urine or dark, sticky, bloody stools, coughing up of coffee ground substances, or even bruises. If you have signs of internal bleeding, please go to the hospital immediately. Bruises are generally self-limiting and should disappear within 1 to 2 weeks. Avoid rubbing these bruises as they may become larger instead. Severe headaches that may or may not be accompanied by nausea or vomiting and confusion should be treated seriously. This could mean bleeding in the brain and it will require admission to the hospital immediately.
That sounds quite scary, but do the side effects always happen?
Do not be too worried. Spontaneous bleeding usually occurs only when the blood is too thin. Hence, close and frequent INR checks are done to maintain INR within the target range. However, please see a doctor immediately if there is severe bleeding. While you are on warfarin, avoid activities that may cause you to become easily injured, such as contact sports. Using a soft bristled toothbrush can help to minimize unnecessary gum bleeding. If you accidentally cut yourself, apply direct pressure to the wound to stop the bleeding. The bleeding should stop, though it may take longer than usual. Seek medical attention immediately if there is any persistent bleeding. Blood clots can still develop while you are taking warfarin, especially before your dose is optimized. Hence, it is important for you to recognize the signs and symptoms of blood clots. These may depend on the location where the blood clots are formed. Deep vein thrombosis in the legs may present as pain, warmth, and swelling in the legs. A clot in the brain, such as stroke, may result in unusual giddiness, blackouts, muscle weakness, slurred speech, or visual disturbances. Pulmonary embolism in the lungs can lead to coughing of blood, breathlessness, or chest pain. Seek medical attention immediately if you develop any of the above signs and symptoms. In the event that you feel unwell, such as fever, diarrhea, vomiting, or loss of appetite, it is advisable to check with your doctor or pharmacist, as these can affect your INR. If you have an accidental fall and hit your head, please seek medical attention at the emergency department even if you feel well, as there might be bleeding in the brain. If you are a female, it is important to note that warfarin may cause birth defects when taken during pregnancy. As with all other medications, it is important to inform your doctor if you intend to conceive. Do inform your doctor or dentist that you are taking warfarin, especially if you are going for any surgery or dental procedures. They will provide the appropriate advice regarding withholding of warfarin for a procedure. Do also inform your family doctor that you are on warfarin, as certain medications such as antibiotics or painkillers may interact with warfarin as well. Do also keep your family members updated that you are taking warfarin as well. Warfarin is a blood thinner medication that helps prevent the formation or further extension of harmful blood clots in the brain, lungs, heart, or legs. Its side effects are closely related to its action on blood thinning. Always remember to watch out for signs and symptoms of bleeding, such as any unusual or extensive bleeding or bruising, nosebleeds, gum bleeds, any red or dark-colored urine, red or black sticky stools, red or coffee ground vomiters, or any sudden onset of severe headache with or without nausea or vomiting. Be compliant to your medications and be consistent with your dietary intake, especially pertaining to foods that contain a high content of vitamin K. Avoid traditional medicines and herbs. Always inform your healthcare providers, especially before going for a surgery or dental procedure. I hope that this video has helped you understand a little bit more about the uses, side effects, and precautions of warfarin. If you have any further questions, please check with your doctor or pharmacist.